Hi everyone. My name is Dr. Wu. I'm a pediatrician based in New York City, and as a lot of you might have heard, there is a stay-at-home order as given by our governor, Governor Cuomo, as well, that all non-essential businesses are going to shut down as of tomorrow. All this in the time of coronavirus. I've been following this situation very closely because I have a private pediatric practice in Chinatown, Manhattan. So literally when that first report came out of Wuhan, China, I thought that we would for sure see somebody walk into my office with coronavirus because I see children all the time from mainland China when they move and immigrate to this country, this great country of ours. They need a pediatrician to sign off that they can go to school. So in any case, I am just posting this online to kind of, talk to people and kind of describe to you what's going on, sort of from both a New York City resident as well as from a physician standpoint. So there are two things really right now that I want to update you guys on. So one is what we're doing in the city right now. As we all have heard, cases have climbed significantly in the last week or 2 weeks, and it's not because suddenly everybody's getting sick. I mean, that's true, but also because we finally started doing some testing. Commercial testing became available about a couple of weeks ago. Although it's still not widespread, in the beginning we still had to double check with the Department of Health, and they were still telling us no. Now we are able to test for coronavirus. However, for example, myself as a private pediatrician, I don't have enough PPE, what's called personal protective equipment, in order to do the nasal swab, which you take a swab and you put it in the nose, because that can cause sneezing, coughing, and spewing and choking and all that good stuff, which is an aerosol generating procedure, and I and anybody else in the vicinity can catch the coronavirus. That's the first reason. The second reason is I simply don't even have the engineering control, meaning I don't have a negative pressure room. I cannot put, the life of my staff on the line. I cannot, it's not responsible doctoring, right? This is like medical school 101, so I still can't physically even do the test. I can order the test. I've been trying to iterate like how do we do that? Can we get the patient to do it themselves? Probably not. It's kind of hard to stick something up your nose, and you don't want them to hurt themselves. In the meanwhile, we've been pushing the state to get more mobile testing sites. I've been trying to figure out how to get like a hospital access to a hospital EHR so I can order it, but then same issue, patients have to go there. I don't want them to have to wait in the emergency room and possibly not even get tested, meanwhile being exposed to a lot of other sick people. So, the first thing I want to talk about is sort of like what's going on right now. Like I said, we know that there are a lot of people right now in the hospital. There are in the ICU on the floors, meaning that the ICU people are severe. Those are patients that you want to intubate. They're using the machine to breathe for them. People on the floors have pneumonia and lower oxygen level in their blood. So they need oxygen, but they aren't sick enough to be intubated, but they're too sick to kind of stay home, right? And as you guys have heard, there's some treatment out there. Nothing is approved. Everything is experimental, just because this virus didn't really exist, in the public conscious until the end of December, right? Beginning to end of December. So I want to say thank you to everybody who is staying home and quarantining themselves, or working from home, or just not going outside. It is absolutely worth it. I would thank all of you for doing it. It is very, very important from the bottom of my heart. Even though I'm sure you've heard children don't, kids under 10, the mortality rate is very low, but, that baby who's a year old can get very, very sick. The grandparents can get very, very sick. So I just want to say, from a first order of business, thank you to everybody who stayed home, who is listening, and just thank you. Really, it really makes a big difference. And I think this virus, from what I've read and what I've observed, this virus doesn't really care, who you are. Maybe unless the fact that you're a kid, you know what I mean? But aside from that, anybody age 10 and up, it doesn't care. What it does care about is how you behave. if you're gonna hang out with a bunch of people, right, there's 25% of all new infections are probably from asymptomatic people. So if you have one person who has the virus in their nose and in their lungs, but they're not sick, they're breathing out the viral particles, right? Viruses only care, this virus only cares what you do, right? Like, are you gonna go and hang out with a lot of people and, talk to them and, like hug them and whatever, like go to a concert and dance and sweat and all that stuff? That's what the virus wants, okay? And I think that's the reason why in China we were seeing a lot more older people get sick, because where did this virus come from? It came from a market, right? So who goes to a market? Families, right? People who go and buy food, flowers, whatever the case is, usually they go in clusters, right? So in the beginning in China, there's 80% of these infections. A lot of them are spread within the family. They say even the healthcare workers, they're kind of wondering, did they catch it at home or did they catch it in the hospital? Whatever, right? But it's close contact. Here, in the US, how is coronavirus being spread, right? Initially, the first case is a travel case. Who travels? Not the old people, not your 60, 70, 80-year-old grandma, grandpa going to China. Usually not. Usually it's a relatively fit person in their 40s or 50s who are traveling for business, for pleasure, whatever the case may be, right? So if you look at it that way and you're the virus, you only care about, all I want to do is like infect somebody and replicate myself and infect more people, right? That's what a virus does, right? So virus, if you can imagine, I'm the virus, I'm going to go from Wuhan to Washington, right? And it's a healthy young person. Most likely that person in this country, in the US, usually young people hang out with other young people, like the Western societies tend to be like that. You tend to move in your cohort of peers. Whereas, say in Asia, which is where I'm from, I'm from Taiwan, the most number of people you hang out with tends to be your family, right? Like I grew up in Taiwan, and I remember if I ever went to a party with like more than 100 people, it's family, right? Here, if I'm going to a party that's more than 100 people, it's my friends, right? I think that's why in America we are seeing a lot more younger folks, because the infection originated differently, and I think the virus is following social patterns. That's why I want to say thank you so much to everybody who's doing the social distancing. That's the first part. Second part of this video I want to talk about is, it doesn't apply to those of you who are staying home and healthy, which thank you very much. It applies to people who are getting sick, okay? So I am a physician. I'm a primary care doctor. I take care of like your general population, right? So a lot of worried well, meaning that they're fine, but then they're worried. But my job is to identify who of those out of the sick, right, or the worried sick, like who is okay-ish to stay home and who is sick enough to have to go to the hospital, right? So this second part is for that group of people, right? So the first part is like the worried well, like what do I say to my families, to my patients who call me, they're sick, what did I tell them, right? This is generally speaking, right? But this is what I tell them. First, I find out whether I have symptoms of COVID, right? We all know by now, right? Fever. Although, in China, the studies are coming out, only 50% of the people who are hospitalized have a fever. Fine. But fever, 50-50, right? And that's 37.5 degrees centigrade, which is 99.5 degrees Fahrenheit, right, or higher. Obviously, second thing is a respiratory virus, and cough, right? So cough, usually a dry cough. Sometimes you do have mucus, but generally speaking, it's a dry and tight cough. Remember, it's a lower respiratory tract infection, right? Myalgias or muscle aches, maybe some headaches, maybe some sore throat, maybe some diarrhea, but the other thing is fatigue. Like a lot of Chinese people talk about being fatigue, fa li, like they feel really tired and lacking energy, right? So first I find out if they have any of those things, right? So, obviously somebody has a fever, shortness of breath, difficulty breathing, coughing, I got to figure out what's going on, right? And the other thing you also look at is like how they feel, right? Like generally speaking, this virus, when you start to get sick, right? Most viruses, when you get sick, especially the flu, you feel like you're hit by like a ton of bricks, right? Or you start to feel like something's coming on and then boom, suddenly you're sick, right? Like you don't feel good. You're like, oh, I need a doctor, right? And you're sick for like 2-3 days. Wake up with a sore throat, you're miserable, and you're coughing and sneezing, like all that stuff, right? Coronavirus is interesting. It starts off kind of like that, like a common cold, But generally speaking, the ones who end up kind of like, the people who have to go to the hospital, right? Like the people who are fine versus people who have to go to a hospital, they usually take a turn for the worse, like a little bit down the line, right? So generally speaking, we don't see that, right? Even this season, the flu, influenza B, it's been a lot of influenza B going around. Generally speaking, those kids are just kind of sick, but they're sick like this. They're like sick, and they're still sick, and they're still sick, right? They don't sort of like get worse, right? Like, influenza B, like I was seeing a lot of like runny nose and some diarrhea, bellyache, vomiting, whatever, right? They're sick, but then they stay kind of status quo, right? Like they don't suddenly take a turn for worse. What does it mean when you take a turn for worse? Energy gets worse. Your appetite gets worse. You feel even more miserable than you had been, right? You're like, oh my gosh, like if 5 days ago I was like a 3, now I'm an 8, right? You're becoming dehydrated, right? Like you're peeing less. So your sleeping is terrible. Either you sleep too much or you sleep you can't get comfortable, right? So like this is all common sense, right? You're getting worse. So coronavirus, the difference is there is a period of time where you're saying common cold, like possibly, I don't know, should I go to the hospital? Maybe not. I'm so worried. I'm scared. But then, a lot of times we see that there is this turnaround time, usually 5 to 10 days, right? Now, if you get better after 5 days, does it mean you didn't have coronavirus? It means that you're going to be fine. You're going to be in the 80% of the people that are going to be fine, like overall speaking. But that's the main thing that I see, okay? So that's the part I want to address, okay? So, and I just want to do sort of like a PSA. So these patients are now going to the hospital. Again, I addressed in the beginning of my video, I don't have enough PPE to do even test my office. And now it looks like our hospitals are going to run out very, very quickly. And this is very important. Listen to me. Our hospitals are going to run out of personal protective equipment, and it is not good. It is not good. And I'm putting a call out to the public. So again, thank you for staying home. But the second part I want the public to do is we have to figure out how to get PPEs for our frontline workers. It is not fair when doctors are scared to go to work because we don't want to die, right? You guys have to believe us. Doctors do not get scared. That's literally why we went to medical school for 4 years and worked these crazy hours, go to residency so we can take care of really, really sick patients, okay? Literally, our job is to remain calm, right, in the face of extreme illness. But now doctors are scared. I'm scared. I'm scared to go to the hospital to volunteer my time because I don't know if I'm going to be adequately protected. The reports coming out of China, Iran, Italy, the writing is on the wall. Frontline healthcare workers are getting sick. They are dropping like flies. People are getting intubated. People are dying. We need PPEs. We need it for the physicians, okay? In the meanwhile, I'm going to keep posting these freaking videos just so people can hear us loud and clear. We need PPEs. So again, to the public, thank you for listening. I know it's a super long video, and this is the most important message, which is at the very end. But that is sort of like number 2. And I think I know why it's at the very end, because we physicians, we're not used to asking for stuff. I don't feel comfortable asking people to do stuff for us. Yet here I am 13 minutes in. We need PPE, please. I don't know what we can do, but whatever, I know there are plenty of smart people out there, people with like influence, whatever it is. We need personal protective equipment. We need N95s, we need gowns, we need eye shields, we need everything. Like we need head to toe coverage. That's the first of when the Chinese doctors stopped getting sick. Chinese doctors and nurses and frontline healthcare workers stopped getting sick, and the infection rate went to 0 is when they did the full body PPE because they know how bad it is. All right, thanks for listening. Have a good night.